Hello, and welcome back to this episode of This Healthy Life podcast. I'm very excited for my new guest today. I have Dr. John Kim, and he is a leading functional medicine pharmacist, and he focuses on root cause medicine and trying to figure out what your chronic illness root cause is. And he has a doctorate in pharmacy, and after his own personal health crisis in 2015, he became passionate about wellness and biomedical treatments. And today he's going to share with us his wealth of knowledge on mast cell activation, cell danger response, and what you need to look for if you're dealing with any of those issues. So Dr. Kim, thank you so much for joining and welcome today.
Erica, thank you so much. It's an honor, and especially hosting me on a Sunday afternoon. I thank you. I was just like, wow, she likes to do all the recordings on a weekend too.
I know. It helps. My weeks are busy, so weekends are when I can get it in and get this content out. So whatever it takes.
No,
so I appreciate you joining me today as well. So I'd love for you to start with a quick introduction about yourself. You have such an amazing journey. I've been following you for so long, and I love the information you share on Instagram. And you had pretty significant health shift in 2015. If you can share a little bit about what kind of shifted in your life and what prompted you down this kind of path of wellness and kind of diving into the functional medicine world.
Yeah, I was 33 years old back in 2015. I went to my friend's wedding in LA, came back 4 days later. I thought I was dealing with a heartburn. Unfortunately, I was actually walking around with a chest pain, basically an angina I was dealing with for 2 days. And that was not smart of me to even ignore the symptoms. But the questionable thing I actually had was the symptoms I was dealing with was not a classical heart attack symptoms, dealing with shortness of breath, sweating, nothing of that nature, except for just for resonating pain around my solar plexus. And then at the end of it all, it's just the pain resonate down to my left arm. So I went to an urgent care center instead of going to the ER. That was very foolish as well. And when I got to the urgent care center, they did an EKG, and then the attending physician came running in and just said, "You're dealing with a heart attack right now. We need to get you to the ER." So I was basically transported into the ER locally, and even the cardiologist and the ER physician didn't even believe that I was dealing with a heart attack because of the fact that my troponin level was less than 1. Young guy, had a recent physical done, looking at an EKG at that point in time was normal, cholesterol level was normal, and this is the main reason why I say normal cholesterol does not equate to, or at least the cholesterol issues equate to dealing with a heart attack. There's always something else going on that could potentiate this. So long story short, did an echo, and I found out that I had a lower left ventricle was not pumping correctly. And so they were like, you know what, this is a sign of ischemia, but to get you to the cath lab and see what you're dealing with. So that's how we found out that at the age of 33, I had an 85% blockage.
Wow.
My lower anterior descending artery, or the widowmaker. And even the cardiologist was completely shocked, apparently. I was the youngest patient to get a stent put in.
I was going to say, it's not something that you really think about when you're 33 or think you're even going to have to deal with, right?
Yeah, exactly. Unfortunately, I didn't get an award for that, except for getting a stent put in. And I was in the ICU for 4 days.
Wow.
And then still dealing with a chest achiness and a bothersome issue that I was dealing with. Got discharged, got home, just completely baffled of what had happened, questioning everything that I was doing, including my work choice, is a stress response, is a family history. I didn't know what was going on. And then I had to at least do something. So I went to talk to my integrative physician. I've been working with her since 2006, known her very well. And I just said, "Hey, I just want some vitamin C drip done because I'm so fatigued." And she just looked at me and she says, "I think you're dealing with some type of a tick-borne illness. Let's do some blood tests. Let's figure out what you're dealing with." And the results came back after 4 weeks of blood draw. And I had a positive results for Bartonella, which is another tick-borne illness, Mycoplasma pneumoniae, Epstein-Barr, high levels of mold antibodies. And then heavy metal was off the roof as well. And so I was basically diagnosed as being a unresolved tick-borne illness, followed by biochemical issues that were dealing in the body. So that's basically what it was. And obviously you don't have a clear diagnosis in this frame of these things because you can't really correlate that, hey, this and this and this is going to cause this. It's just overall the beauty of functional medicine is that the root cause, or at least the clinical aspect into the listings out, that all of these things can result in X, Y, and Z. And so that's when the treatment started. It took me about 2 years just to get my body back in order. And it was painful. I'm not going to lie about that. It was many cases. I was doing phospholipid IV trips at that point, including glutathione and many other detox protocols, and also using antimicrobials. And some of the days I couldn't even get out of bed because I was dealing with so many achiness, die-off reaction was off the roof, cystic acne, all of this. I mean, I had already cystic acne to begin with. And it's just a sign of a gut issue that I completely didn't realize, or at least I knew, but I was just trying to just manage it on my own and didn't realize I was dealing with a deeper issue internally and having to deal with this. So there was a lot of questionable things that were going on in my body, but I thought I could just manage it based on what I knew. But that just became a focal point for me to be really humbled and realizing that there's a much deeper issue within the body, not even just pathogen-wise, but biochemically, cellular health, mitochondrial dysfunction. And then now I'm actually more dealing with how to manage overall internal nervous system dysfunction, how that leads into your immunity being shot, right? Hormonal dysfunction, gut issues. And so my practice has been really evolving for the last 2-3 years, looking at not only about issue dealing with potential mold issues or mast cell problem. And we'll talk more about the mast cell issues because there was one case that really humbled me beyond. But that really taught me how to think outside the box, that I have to look at more holistic in terms of the body, spirit, and the mind, right? So that's the reason why even just the hierarchical matters you have to deal with in treating the patient is not just about the pathogens, not about the supplement. It's about the foundational aspect that we have to get through to really get into the aspect to build a person up, right? To be resilient within the environment. So that's why they don't react to the stuff that they're dealing with.
Absolutely. Because all this stuff is in our environment and it's just getting worse and worse. So it's like we have to build ourselves up and make ourselves resilient and let our bodies kind of withstand all these exposures that we're constantly going to be getting exposed to.
Yeah, absolutely. And so that's my journey for almost 10 years at this point. And it was a humbling moment, and as well as a enlightening moment for me to transition to what I'm doing right now.
Mm-hmm. And so before this health journey started, were you kind of, as a pharmacist, were you more kind of like on the Western side of things, or were you already kind of dabbling in functional medicine and having some understanding of it? Or was it your own personal journey that really kind of dove you deep into this world of kind of looking for root causes and really kind of healing the body on a deeper level?
Yeah, that's a good question. So I always grew up in a holistic household. So I was born in South Korea. And when I was growing up, my grandparents raised me. And during that time, my grandparents were very big into holistic health, sending me to an acupuncturist every month, checking my meridians out. Things holistic that we did was, waking up early, getting to bed early. Things I'm talking about now, and I'm just like, I hated it when I was little. I'm just like, wow, what a fortunate thing.
Like, oh man, my parents were right, or my grandparents were right. I was getting set up well.
Exactly. And then as well as they had produce that were growing at their house. My grandparents always looked that into a clean eating process. I still remember my grandmother would actually make soup from scratch, grinding up all the nuts up, pine nuts especially. And then as well as at that point in time, my grandfather was diagnosed with lung cancer. So even then she was utilizing chitosan, which is basically a hard shell crustacean extract they're utilizing to help immune health, and as well as potentially using that for cancer. And he actually lived with lung cancer for 6 years. That's the epitome of what my grandmother did for him. But these are things I always looked at. We went on a hike on a Sunday. Went to a fresh spring that we would collect water and bring it home. My grandparents was very devout Buddhist. I'm a born again Christian, but over a religious aspect of it, spiritual health, the environment, and then as well as a holistic eating process. All these were ingrained into who I grew up as. But coming to the United States and then going into the more that Western medicine style, being in pharmacy school, you start to question how some of the didactic lecture materials that you were given does not fit into the overall what you were taught, right? So this is the important part is you as a person, if you want to build up a healthy household, it has to start from you. It's a culture that you have to bring. It's not about, oh, it's the biohacking things that you have to pick up. You don't have to buy these glasses or anything. Like I use it because it helped a lot. And especially when on a podcast like this, I'm going to be staring at a screen or I have a light above me, that affects my nervous system. But naturally, if you think about how simple it was, and if you look at the Japanese culture, even Korean and Chinese, the holistic health is very simplified, right? It's about how you eat well, family structure, love, spirituality, right? Being in nature. All those are simple things that we are supposed to do, but now is basically enveloped as being the biohacking, right? As a biohacking.
So just a foundation.
It's a foundation. There's a biohacking, and then they're selling courses out of this. I'm just like, what is this?
How do I get more sunlight?
Right? $9.99. I mean, there's a one person selling about circadian rhythm. I'm just like, my grandparents would have taught that one.
Maybe you need to get them going on some master classes.
Right, exactly. Here's my grandmother. She will teach you all about the master class on circadian rhythm. Yeah, go to sleep early, okay? And eat at a proper time. Done deal. No, I'm all joking aside, but that's the type of things that I was taught. And then the pinnacle moment that happened was I was in a ER rotation. I had this one woman that came in every single week with the same issue of uncontrollable high blood pressure. And we didn't do anything except for just upping her medication. We didn't manage about holistic health, nervous system dysfunction, nothing. But when you look at that time it was 2005 and JNC 7 guideline came out. That's basically the Bible of how to deal with hypertension. And the first thing they recommend is lifestyle change. They didn't ever talk anything about that in the ER, except for just getting the person out the door. And she's just coming back with the same issue. So what did we fix? Nothing. And the whole term of something called pharmaceutical care, that term was ingrained to us when I was in pharmacy school. And that basically means how to optimize medications to get the outcome possible, right? If you could optimize based on 3 to 4 medications sometimes to lower her blood pressure and she could maintain that low blood pressure, that's a done deal. Right? It doesn't fix anything except for how many more medications can we add in. And this is a side that I really hated it. So when I was doing a rotation down in Texas, I'm in New Jersey, but I did a rotation down in Texas, and I met this pharmacist who was working at a compounding pharmacy. And if any listeners don't know what compounding means, is compounding is a customized medication for patients' needs. So let's just say if you're allergic to certain ingredients, or let's just say you need a customized hormone therapy, compounding pharmacists are there to really think outside the box to help you. So this is a particular rotation that I really enjoyed doing, and this is what I wanted to do. And my early part of pharmacy career has been in compounding. I built a compounding lab, and I was actually awarded as one of the top innovative compounding pharmacists back in 2017. So I've already been in this field for a long period of time. But that particular rotation that I did in Texas, that particular gentleman was seeing patients an hour away, 30 minutes away, coming to him because they want to talk about holistic health. Right? He was doing functional medicine, but he just called it holistic, how to optimize nutrition. So even then, he had an entire protocol to deal with chronic constipation. The first thing he told the patient to do was get rid of gluten, get rid of milk, get the gut inflammation down. This is 2005. What are we talking about still? Same stuff. Right? Nothing had really changed except for what had happened now is that all the social media influencers are just enveloping the same material and just regurgitating into thinking that this is an innovative thing. Yeah. But that's how broken American medicine is, because even those informations were available back in 2005, nothing's been done or nothing's been changed.
And medical practitioners still aren't talking about it or using that with their patients either. Yeah.
Absolutely. And so we're still dealing with the same issue, just worse scenario now.
Yeah. Sicker people, unfortunately.
Yep. Absolutely.
So I want to shift gears a little bit. So you talk a lot about mast cell activation syndrome on your page, and work with a lot of people in your practice as well. And it seems like just such a common thing, like you're saying, like, these things are being thrown around, like don't eat gluten, don't eat dairy, but like it's something new. And mast cell activation has just been all over the place lately. So I'd love for you to share a little bit about exactly what it is, what some of the symptoms are, and how this is becoming such a big issue that so many people are dealing with.
So mast cell is very hard to diagnose. The reason being is people have multiple symptoms. They are not able to get under control. They go to multiple physicians, even regular doctors don't even know what mast cell is, and cannot get to the overall quote unquote diagnosis. Right? Even the diagnosis why it's so difficult is because there's not many trained physicians out there. So what is mast cell? Mast cell is basically inappropriate release of chemical mediators from the mast cell in itself. And it's commonly mistaken as being a histamine intolerance, but there's a lot more histamine issue than just dealing with these things. So even though the histamine becomes like the major component of mast cell issues, there's definitely intolerance to the overall environment. And even the root cause wise, there's several, right? Even to deal with this mast cell issues, there's an underlying cause of potentially bacterial, viral, could be from fungal infections down to heavy metals, herbicide, to mold illness. And mold issue can be a huge impact in triggering mast cell issues. Then you're dealing with allergens and then genetic disposition, right? So if you actually have COMT problem or dealing with an MTHFR issue, you're more likely to develop this particular thing. And then the last layer, I think I look at this much more now, is a childhood development issue, such as trauma or family dynamic. So when you're dealing with MCAS, addressing the single source of the issue is not going to fix the entire problem. So when you are in a scenario, or at least a practitioner, this happens to be the case with functional medicine providers as well, they have a singular approach of how they want to fix the patient. And I actually made a term that you need to look at, and I think I posted on my birthday post, that you have to look at in a 4-dimensional approach, looking at this, not a singular, but you have to look at the 4 different equation of the picture of what you're dealing with, or 4D for that matter. So what is that? It could be spiritual. I just mentioned about spiritual before, right? Cell membrane, right? So it could be leading to mitochondrial dysfunction, microbiome issues, right? And then the environment, right? So entirety of enveloping what the potential issue could be, that's the biggest issue. So even though I work with a lot of clients dealing with mold issues and MCAS, but because of the fact that my overall credential as being a licensed pharmacist, I cannot diagnose, right? So I look at these things into how do we calm the patient's overall symptoms and getting the patients to be less reactive based on the 4 criteria I look at into implementing these things. So that's why it becomes a very difficult part. And so, right, proper testing needs to be done. And even if you look at the triggerings of MCAS, there could be non-food related MCAS issue as well. People always think that MCAS is all dealing with food sensitivity. Yeah. No, it's not. It could be extreme temperature, it could be hot or cold. So these patients cannot be doing cold plunge. Right? So like, it's cold plunge is good. Or
too,
sauna,
right?
for that matter. I mean, you could tolerate low heat, but you cannot be doing, very high levels of it. And so even when I work with clients, they're so headstrong about getting themselves better, which is good, but they just jump in way too quickly, right? There are ways to implement and slowly introducing supplements, never alone lifestyle changes, but you cannot jump in all in and then thinking that you're going to fix the problem. So that's a big issue. And then you're dealing with mold exposure and Lyme disease, for that matter, and then as a co-infections. Emotional stress is a big one. Every little thing that shouldn't be triggering them, or at least their threshold to be triggered, is much lower. So even if you actually, let's just say, had a bad day because of X, Y, and Z, can throw them into an entire flare, right? Or they had a trigger moment in terms of the childhood experience that end up having to be repressed, that came back and then having to cause a lot more issues, right? Someone who you decide to cut them out from in your life this had to come back and that causing symptoms. Like there's a lot of things that you cannot think about. And then you're dealing with insect bites, chemicals, and personal products. Certain medications can cause that, especially Benadryl. Even though Benadryl, we think that is good for histamine, Benadryl can actually cause more liberation of these histamine to be released after the medication is worn off. Like it's almost like you're suppressing the issue, and also the Benadryl wore off, and then the issue
comes back even worse. Huh?
Right.
That's interesting.
So you cannot be dealing with that, and that's the reason why I don't really recommend these things that well. Only things that I usually recommend are the second or third generation antihistamine blockers like Xyzal, or even looking at Zyrtec, and then even looking at H2 blockers, which are the famotidine, like Pepcid. Even though Pepcids are, oh my God, that's so bad to take because your gut. No, in certain cases, you need to use those to get the symptoms under control.
Yeah.
Right. And you're blocking both H1 and H2 pathway. Sorry.
And then, so what are some common symptoms of mast cell activation? So you mentioned, people think like, oh, I eat something, I'm allergic, so I'm having a histamine response to it, or I got a bug bite and it's kind of flaring. But, those are just kind of like the tip of the iceberg with mast cell activation. So what are some other symptoms that people might experience if they're dealing with mast cell activation?
Oh, wow. Symptoms could be quite a bit. Symptoms could be, let's look at the top ones. Obviously fatigue and sensitivity to food and medication is the big one, right? Nasal congestion, shortness of breath could be another. You're dealing with neurological issues like headache or migraines. The mental emotional could be less bit of dealing with concentration, memory, or anxiety issues. Then there's an achiness in dealing with musculoskeletal issues. Digestive problems are a huge component, where about 60% of patients who are dealing with mast cells are already dealing with some kind of gut problem. So heartburn is a big one, diarrhea, abdominal cramping, skin flushing, hives, itchiness, or temperature sensitivity or dysregulation that occurs. Cardiovascular issue could be high or low blood pressure. These patients can have some type of POTS-related symptoms as well. They have racing heart, or in a worse scenario, hypercoagulation. Right? Certain mold toxins can cause hypercoagulation, but in certain cases, these things can cause the platelets to be very sticky. So the blood tends to be thicker as well. And then there's a genital urinary issues, especially irritable bladder or interstitial cystitis, that I see a lot in my patients, where we do special compounds for them to just manage the symptoms, not getting rid of the problem.
Yeah, it's a lot. And I have a couple of friends that have really struggled with mast cell activation. And it's been such a journey with them, like making sure to clean out the environment and kind of address all the things that you're talking about. But just managing the symptoms alone sometimes can just be so overwhelming. And then before you can even kind of start getting to the root cause and dealing with the root of the issue, or tolerating the treatments that you're going to be doing for it as well, right? Because it's like people become so sensitive. And so another big piece of that, kind of like the mast cell component, is like the cell danger response is kind of the new big thing too, right? So talking about like our cellular membrane and how we really need to kind of heal our cells and our mitochondria before we heal from any of these chronic conditions, whether it's mast cell, Lyme, mold, like all these things that people are dealing with. So can you share a little bit about that and how we can work on our cellular health and how that can help heal us too?
The reason that I'm smiling and laughing right now is that cell danger response. So it's such a very complex topic to explain over a podcast. So I'll try to
let's do the cliff notes, just the high level. And we can always do another episode and dive into it a little bit more too.
Oh my God, you're going to bore everybody. So
I love this stuff.
So simply, what cell danger response is a evolutionary metabolic response to protecting the cell and the host from harm, right? People think that cell danger response is a symptom or diagnosis. No, it's not. It's a description written and formulated by Dr. Robert Navio. He is a MD, PhD out of UC Davis in California. And really, he works with the autism spectrum families and groups. And he coined that term cell danger response to better help us to understand the metabolomic changes that goes on within the body itself. And his lab actually had done tons of other studies to really help to justify, and as well as to putting additional data to his overall theory is correct. And this is how I end up having to manage the patients when I look at this, especially when you're going to talk about the healing cycle that Dr. Robert Navio has written in his papers. that's exactly the format that I go through to help the patients as well. So I talked about the cell dangerous response as being an evolutionary impact. Well, the triggering of what the cell dangerous response could be biological, chemical, physical, and psychological. Everything that I just talked about with mast cell is literally what these triggers could be. So what is biological? Could be viruses, bacteria, fungus, and parasites. Chemicals could be heavy metals, could be from BPA, flame retardants, right? Some people could be getting into a car and then they smell the new car smell and then they're getting really sick. Like for me, I have such a sensitivity to car fresheners.
Yes.
Like I have to literally like hold my hand and, and my nose. But those little simple things like that could be triggering a lot of things. Physical aspect of it, such as heat, salt, any certain pH change goes in the body, or psychological trauma is a big one too. Now we're talking about the family dynamic we mentioned about, or maybe you had an accident, car accident that could be triggering it. And or I've seen clients where they were thrown off their horse. Like I have a lot of equestrians that I consult with, and all of a sudden they're dealing with all these symptoms. Like, okay, so what had happened? Well, I think I'm in a moldy place. Okay, then talk to me about your childhood. What did you do at growing up? Well, I was equestrian. I was like, were you thrown off the horse? Yes, I had a couple instances like that. Well, that's head trauma that goes on. And then when you're dealing with head TBI or traumatic brain injuries in severe scenarios, not only affects the brain, but also affects the gut. Why? There's a gut-brain axis that's completely affected. And that inflammation neurologically leads into microbiome changes and then the cell danger response and triggering and multiple issue dealing with cytokine activity, which can trigger the meta-inflammation that goes in your gut, right? And then there's a follow-through with these things. So the biggest thing that actually occurs during the cell danger response is that the mitochondria actually alters the ATP production, the energy production, or the cellular metabolism to shield it from further injuries. You might be wondering, what the heck does that mean? Basically, it's downgrading the mitochondrial function to act as a protective mechanism, right? So this is the part that practitioners don't understand. Oh my God, the mitochondria is in a dysfunction that we need to give all these mitochondrial supporting supplements like CoQ10, L-carnitine, and things like that, including B vitamins, thinking that's going to be the most powerful thing to help with the methylation process and supporting the mitochondria. In certain cases, you're making that condition worse, right? So you have to really sit back and find out what is the root cause of the issue. What stage of the cell danger response is this patient in, right? Is it more innate immunity, or is it more the fact that their person is in a abnormal state of proliferative phase, and we'll discuss a little more, right? Or is there certain cases where they are dealing with autoimmune issues where the proliferative phase, or at least the metabolic phase of the organs and the systems, end up having to change because of epigenetic changes that went on, right? There's all could be stemming from improper healing cycle that goes in the body. The body has an actual mechanism to heal. But if there's enough stressor that goes on, it puts so much pressure and the stress within the cell itself that there's an improper healing that goes on. And in tune, it changes the epigenetic expression of the cells and the organs. And then there's a disease state that occurs. So one of the good examples that I mentioned about is how heavy metals, including mold toxicity, end up having to be embedded within the cell structure, as was the DNA. That's called a DNA adduct, right? So if that happens, what happens is that it changes the epigenetic expression of that cell itself. The functions change. That's basically what it means. And when you're talking about Hashimoto, for instance, or underlying issue with the gut, or a poor functioning thyroid function in itself, that is probably the cause of those things that occurs. Or having to see patients where they have chronic Lyme disease and they have a low vitamin D, and even the supplementation doesn't work well. What's happening? Could be malabsorption, but Lyme disease, for instance, can actually downgrade the vitamin D receptor. So this is the biggest issue that comes in. So giving additional vitamin D makes the condition worse. So when you look at the cell danger response, and the way that Dr. Ravanavia talks about is that in a certain issue dealing with the cell danger response, vitamin D gets deactivated and then becomes pro-inflammatory. So giving additional vitamin D doesn't really work well. In a scenario like these patients, I would actually recommend more dealing with what? Circadian rhythm changes, supporting them cellularly, have them go outside in the sun. Mm-hmm. And sun is not just about making vitamin D, it has multiple other functions to do that, including microbiome and your neurological functions. And this is the part that we kind of jumping into different topics right now. Even like the sun actually helps the methylation process. Right? This is an important part that we have to realize to support the cell danger response correctly. So this way the body's able to cultivate and get into a proper healing mechanism. Another thing that occurs during the cell danger response is two issues, actually more like three. The first thing is that because the cells are under danger and is to contain that particular issue within the cell, the mitochondria starts to pump out phospholipids within the cell to lock that cell down, is to prevent any other egress of the different pathogens. I just said there is a viral infection that goes on. The virus ended up having to be, if you remember biology class in our sixth grade, we talked about the analogy of a little virus going into a cell, they start replicating, and then they cause apoptosis, the cell dies, and it spreads everywhere. The mitochondria, as an evolutionary period to protect the body in itself, it contains the damage within that by pumping out the phospholipids. So the cell is under lock, it's not communicating, and then there's multiple other chemicals within the cells to neutralize the virus. But another really interesting part that occurs is that the mitochondria shuts down methylation. You heard that. Wow. The mitochondria shuts the methylation down. Why? Because the virus can actually hijack the methylation process to start replicating even more. So what is the body trying to do? It's trying to shut that process down to reserve energy capacity, but allow proper ways to protect further damage from occurring. So by giving B vitamins, for instance, methylated B vitamins, for instance, at the different stages of the cell danger response, what the person's going through, and a person's getting severely sick, that's the reason why. It could be the fact that you're over-cranking the methylation process, and that could be one issue. But the second could be is that you're making the conditions worse by adding in these supplements when it's not needed at that proper point of time. So you have to look at what's really happening with that client. So that's basically the 2 points I'm making. And then the last part is that mitochondria end up having to release certain cytokines and cell messengers to trigger a sick response in the body. And then, you start having certain things like to be a lot of fatigue, to reserve capacity, the energy. And so there's a whole explanation in terms of how the person gets sick down to starting to get better. Mm-hmm. Right? So that's a simple ways to explain it. I know I could go even more detailed about these things.
No, that's a good high level view of it. And so, when someone's dealing with chronic illness, are there any sorts of tests that you can do to either test to see kind of like their cellular health and see how their mitochondria is doing and, see what's going on with that? Or do you just assume that if they're dealing with some sort of chronic long-term illness with some of these symptoms that are just so common, like the fatigue and the achiness and, hyperreacting to things, you just assume that they're all dealing with some sort of cell danger response and mitochondria dysfunction, that you just address that in every patient?
Yeah, so that kind of goes into the whole healing cycle. That would explain, what areas, or at least which cycle of the process of cell danger response that the patient's in. So the cell danger response 1 is contain the issue, such as contain the virus, and then the innate immunity kicks in, right? I mentioned about how the new formation of injury or toxins or infections causes a trigger of the immune response. And then that excessive metabolic damages leads into apoptosis or leads into a process to contain the damage within that and shutting the metabolic process down within the cell. And then that leads into cell danger response 2, where you actually have a proliferative or in a aerobic glycolysis, which is very poor response to dealing with metabolism. But during that process, if you think about it, let's just say you have a cut and the cell starts to replicate and grow. That is a proliferative phase to help to mend that particular injury. right? But if that particular injury is constantly being re-injured, what happens? You actually have scar formation within that hand, or having a overgrowth of the tissue as well. So you have keloids, for instance. So that's basically an easy way to explain about what cell danger response 2 phases. And then the third phase, the cell danger 3, is talking about the differentiation and development. If the differentiation of the cell growth occurs incorrectly, right, that may end up having to change a different function of the cells in itself, but it can lead into autoimmunity or excitotoxicity that occurs, chronic pain, neurological or psychological symptoms that occurs as well. I forgot to mention about the cell danger response to the proliferative phase. If the overall cellular metabolic process runs incorrectly, that also can lead into cancer. Right. So to better explain about what the first, second, and third phase of cell danger response is that there are ways that Dr. Robert Navier explained about how certain disease states that come into place. So when you talk about cell danger response 1 disorder or the innate immunity disorder, in a worst scenario, it could be septic shock, acute respiratory distress, allergies, asthma, and atopy, or chronic infections. And majority of patients that I see, they're already in the cell danger response 1, and the body's not able to contain the issue, and they're still going through an ongoing phase of the innate immune response, right? So that's basically what cell danger response 1 is. And then the cell danger response 2 disorder is the proliferative phase. It could be dyslipidemia, so high cholesterol level, BPH, keloid formation, diabetes, inflammatory bowel disease, cirrhosis, cancer, leukemia. And then the last part that we explained about the cell danger response 3, autism spectrum disorder, Parkinson's, neuropathy, PTSD, POTS, PANDAS, and PANS, ALS, migraine headaches, schizophrenia, or acute psychosis. I mean, those are the type of things that occurs and better explain what the phase of the cell danger response is.
Mm-hmm. And then, so when you're working with someone that has cell danger response, I mean, do you consider that kind of the root cause of what the dysregulation is? Or do you consider their exposure to mold or their exposure to tick-borne disease as kind of the root cause that you need to address first, and then you can start addressing the health of the cells?
Yeah. So that is a loaded question. The reason that you mentioned as a loaded question is not the fact that it's about anything else. It's very difficult to really explain what happens, because it's not just about the symptoms you're dealing with. You have to also clinically differentiate what the potential root causes are. So I just mentioned about how we have to look at in a 4D approach, looking at the family or the nervous system dysfunction kind of fits into place. You're dealing with the cellular health, then the microbiome change, and then the environment. So those are 4 ways I look at these things when the patient comes in. And so even when I look at setting up a supplement protocol, it's a 4-step process into look at these things. Cellular health, right? Even looking at the neurological or how to reset the mind-body work, right? Also looking at the detox pathway to help deal with the environmental burden you're dealing with, microbiome changes, and then attacking the pathogens, right? So those are the ways I look at these things. So proper testing is a must. So if I suspect that the person is dealing with some of the root cause issues that is causing mast cell, then I would say, hey, let's look at total tox burden, and looking at the mold issues. Could be environmental or it could be from heavy metals. And then if there's a deeper issue that it could be Lyme, then we probably need to do some tick-borne testing to differentiate these things. A lot of these patients actually have Lyme disease and Bartonella, or a mixture of multiple things. Virus is a big problem, such as Epstein-Barr, as well as Coxsackie virus. Parvovirus is seeing a lot within the patient's gut testing.
Interesting.
Parvovirus. So
how are people getting that? How do people get parvo? I think of puppies with parvo, but I don't think of humans with parvo, right?
Yeah. I think it's more dealing with the post-COVID issues in dealing with this. And so, virus in general is everywhere, but it's just the cellular resiliency is not there because of the infection that they recently had, and then maybe triggering it even more. So it's a very interesting part that I'm seeing. So even though it's a loaded question, but that's how I start the patients. And it better explain them, hey, these are going to be costing you a lot of money in terms of investing in these labs. But if you don't do this, it's really hard for me to see what the potential root causes are and really navigate that through. But the biggest thing that we have to look at is looking at the foundational care. So what does that look like? The dietary changes and then the gut health. Right? That's the first thing that I always look at. Second is how to optimize detox pathway and then open up the drainage pathway as well. If the person is constipated, there's no way you're going to be able to get this patient worked up, right? And then looking at the environment function itself, right? If the environment is not clean, right? Let's just say there's a mold overgrowth there, they have to understand that you need to remediate the mold problem. If not, it's a problem in itself. I also teach them how to look at the environment based on the humidity levels as well. Air testing could be more into dealing with dust or at least surface testing for mold particles, followed by getting a good HEPA filter. And then the next part is, do you have a peaceful house? Right? If you're constantly dealing with some type of stressors, let's just say your spouse is not supportive, right? That could be a problem. So work stress could be a big problem, right? So you might need to work with a cognitive behavioral therapist. I could teach you how to do breath work, and I'd utilize heart coherency technique by HeartMath. And it's really powerful to help. Yep, it's really helpful to help get with the underlying nervous system dysfunction, but you need deeper work. You may need to do somatic or work with a cognitive behavioral therapist to teach you how to look at and recognize what the trigger points are and allowing yourself to regulate that. We have all the powers to do so, but because if you are constantly worried about the stuff you're dealing with, you cannot see what the triggers are, right? So this is a way that we end up having to train the patients. And then after that is, how do we calm the inflammation and histamine response? Then how do I optimize sleep, right? So that's basically and then the spiritual part. The spiritual, great, we add that in there, but that's basically the foundational part. And then once the results come back, we tackled yeast and mold issue first, not parasites, yeast and mold. Why? Yeast and mold end up having to impact the immune system much, much more worse compared to parasite in itself. And if you do the overall parasite cleanse way too early, I'm not saying this is you should need it. In certain cases, you probably need to help to clean up the parasitic issues because that also triggers the microbiome imbalance. But there's a hierarchical preference that you got to take care of. Mold issue first, followed by parasites, followed by Lyme, then virus, and then so on. But you also have to look at microbiome issue dealing with biofilms as well. If the biofilm issue, because you had a history of taking antibiotic for a long period of time, right? If there's an underlying issue dealing with mold, heavy metals, those are one of the enveloping issues that can increase the thickness of the biofilm. So certain enzymes needs to be used. And then also phospholipids. So I love using body bio PC, not only for cellular membrane support, but also to help loosen up the biofilm issue itself, because phospholipids are considered to be an emulsifier. So it helps to loosen up the biofilms. And then the mitochondrial function. So mitochondrial function, support is already there. I already started those things out, but at the end of it all, once they're completely done with the program, it does take about 6 months. I implement to rebuilding the entire process of the body to optimize the cellular health and overall giving them more empowerment and being resilient to the environment.
Mm-hmm. Awesome. So kind of leaving off with one last question, I want you to share a really awesome kind of success story that you've had in working in your practice with someone that you've had come through your program and that you've helped with all these issues. What's kind of one or two amazing success stories that you've had with clients lately? Yeah,
I mean, I will share my failures and I'll also share my success. So the success story that I actually had is a gentleman who came in and he actually had dealt with chronic diarrhea. He was tested positive for mold toxicity, very bad actually when he came in. and had a positive test for H. pylori. And he was dealing with chronic diarrhea for over a year. Went to one of the functional nutritionists, and the person said, H. pylori could just stay and it's going to go away. We know that that's not the scenario. So we start to work on the person's gut, at least to allow them to tolerate the food that they were eating. So what we did was we did a very strict overall carnivore / a seasonal paleo diet that we implemented. Now that in itself caused a lot of symptoms because the body was not used to eating that much meat, but it was needed to at least to shift the issue dealing with elimination diet that he needed. So we also eliminated oxalates, nightshade vegetables, old seed oils, followed by anything processed we got rid of. So really helping to get the clean diet that we're looking at. And then we did an update stool testing to see any other changes that went on between the year of the testing that had done. And then the mold testing itself, we also repeated. So it still came back high levels of chalcothiecins, which is a black mold, followed by high levels of gliotoxin and then aflatoxins as well. He also had very poor fat absorption. So anytime he took PC, it just ran right through him, right? And then he also had high levels of zonulin, which is showing this fact that he actually had leaky gut. We put him on a cell membrane supporting diet even more, just following that seasonal paleo diet. That's what basically it, and giving them healthy fat, really optimize the fatty acid intake for him. And then just slowly, we start to phase into antimicrobials, such as antifungal and the parasites. And after 5 months, we're able to clear out all the mold toxins right off the bat. He's not getting triggered to the issue dealing with the environment. And then also his stools are solid, right? There are some residual issues dealing with the esophageal issues right now. He has to get an endoscopy done. But other than that, I mean, for him, from what he had done from month of November last year up to now is just a 9-day difference we had achieved. And so he just got his life back. Even his mom ended up having to reach out to me saying that, thanks so much for taking care of him, because it's just really helped him to achieve what he needs to be. He's less reactive, he's happier. So that's been a success story of it. So that's more of how we look at the root cause issues and really getting to explain to a patient about the foundational care, especially the dietary changes and detox, and getting to the overall root cause issue with the microbiome issues, including cellular health, and getting that patient back in order. So that is a success story. And I'm going to ask him if I could share these stories. I do share quite readily because just the night and the difference. But the more the failures I actually had was I had a client who was 33 years old. And I knew that she actually had lived in a moldy house. I mean, it cost a lot of money to take care of the mold, but didn't realize there was a underlying issue, major underlying issue from nervous system dysfunction. Grew up in a very abusive household, was a crystal meth user, right? And then already had a poor diet, very lacked in the foundation aspect, right? And then even though I thought I was asking the right questions, she was not really communicating, answering. So those are things that end up having to be a failure in that person's care. So she is I think she's still under a different doctor at this point in time, and hopefully she gets better. But that's a particular case that I could not understand what the failure was until there's a hidden issue with nervous system dysfunction. And then if there's a lack of communication, proper communication, if the person actually has a pleasing state where they have to think that they have to please a practitioner or please someone who's in the household or the parents just to get love, that's a problem, right? That's a problem. And that's what we see with people dealing with mast cell issues, right? So we didn't even talk about the 5 key points of, I actually did a webinar recently about, what's the first thing that we need to address. It's about discovery number 1, addressing the nervous system dysfunction to start the healing process, right? And then there's a big component to the impact of early experiences, especially the role of the family dynamic, including trauma, and then also helping them to understand that resolving early developmental issues for better health outcome is really needed. It's not about the supplement. right? So the mental health and physical symptoms must be addressed, and generally talk therapies do not work.
Yeah. It
Right.
has to be something more somatic and kind of getting more into resetting their nervous system, right?
Yeah, absolutely. And so that was a part that, I mean, that was recent last year, but that particular case really humbled me. I think really, I was just like, I felt bad. I mean, I was like, I thought I was helping her, but one other thing was that there was a lack of communication that went on. So for me, when I work with a client now, I have a very extensive intake form asking about, do you have trauma? The second thing is, what are your current issues that you're dealing with? Not talking about your illness, or you have trouble with your marriage, trouble paying bills, right? Work stress, right? All these things are triggering part that I always end up having to ask. How committed are you? Right? They're like, oh my God, Dr. Kim, I want to join this. I know I need this. And then they join and then they're like, oh, it's too overwhelming. Well, you're not ready. Right? So that in itself is going to trigger a lot of mast cell issues. So what am I achieving at this point in time? So I've had clients where they come in, they want to work with me, but you're still eating Doritos. I need you to clean your diet out for 3 months and then come back. If you feel better, good. You don't have to see it. But that's not the point where you should be starting at this point in time.
Well, I mean, it just shows like what a big part of healing, it's like obviously one part physical, but so much of it is kind of like that mental, emotional state as well, that you kind of have to get your body into like wanting to heal and like being worthy of healing, right? And putting that energy into it and being in an emotional state that you're ready to do that. I think it's just such a huge piece of it. And, I mean, just from being in the Lyme community myself, like I see so many people that just feel like they can't heal or have like a lot of like emotional like baggage or mental things that are kind of blocking them from healing. And they're doing every single protocol, spending money on all these protocols, but they're just kind of missing one big, huge piece of it. That's kind of a catalyst in being able to help you fully heal.
Absolutely. And then the importance of light and circadian rhythm is so important on these patients. I mean, I have already 3 patients that used to dealt with severe mast cell issues. Once we got to that matter from the start, it was hard, but from the start, symptoms starts to get less, right? So the overall cellular health, circadian rhythm, light and day changes that goes on. In certain cases, you might have to spend in total darkness for about 2 weeks at night. So you're blocking out blue light, wearing these type of glasses. I mean, I have something much more darker than that, and which is another powerful thing. But it's just a particular tool, but you don't have to spend the money on these things. You can do it on your own. Just make sure you're very mindful of what your environment looks like, what you're feeding in, what you're watching as well, right? So, and then another powerful thing that I always have to explain to patients is that blue light blocks the methionine pathway within the methylation process. So you cannot detox very well.
And we're all just on our screens all night long, right? All day, all night. Yeah.
It's a light. So, so I look at much more deeply. I mean, I don't know how I'm going to be like in a year. I'll probably end up having to say, oh, all antimicrobials should not be used. Who knows? But it's just the evolutionary aspect in terms of what I gone through, back in 2015 versus now, how I look at patients and how I holistically approach these things are far different. And, the results speak for itself. Patients are doing much better, and I'm getting complete satisfaction from that. And then, if I could change one person's life, I mean, that's a wonderful thing.
Absolutely. Awesome. Well, thank you so much for all this information. I want to have you share just briefly about your practice if people want to work with you. I know you have an offer as well, so I'll go ahead and let you share about that.
Yeah, absolutely. If you want to find me, I'm always active on Instagram. It's dr.john.pharmd. And you can reach out to me on my website. It's drkimwellness.com. There's a book consultation link, as well as some of my favorite products I recommend patients to get, including entire full script account that you could get discounts on. And then if you really want to work with me, and if you have listened to it until the very end, I have a very special offer for Erica's listeners. So the link will be on the bottom, and hopefully that will be shared properly, and it will be heavily discounted. I'll talk about what cell danger response is, how to properly help with the cellular health. And I think there are certain things that we didn't talk about today about phospholipid therapy and how to support the cellular health properly. But hopefully I get to come back second time to talk about
Yes.
those things in
I would
lieu
love
of
that.
cell-dead response.
Awesome. I would love that. Thank you so much. We'll go ahead and link to everything in the show notes as well. And I appreciate you being on my podcast today.
Thank you so much. It was an honor.